Hello, Maarten. Welcome to Speaking of Other Thing. With me, I have a very, 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 very interesting guest. Now, you all know this young lady. She is Miss Eileen Healy. How are you doing?
I'm fine, thank you.
Well, it's good to have you in the program. Happy New Year to you.
Thank you for having me.
You are really a remarkable lady. You know, you came to St. Maarten many years ago and took on an issue that many of us took for granted in St. Maarten, which is mental health. Today, in 2025, I can say we can see the work that and the foundation that you laid and how great the society is changing when it comes to mental health in terms of the stigma. We can see less of a problem in that area. You really was a pioneer in that when you started off with the mental health. I hope I hadn't said anything that is wrong there.
No. Well, actually, what a lot of people don't realize is that the foundation was founded by government in 2000. And it took until 2006 for them to allocate a startup fund. I, by accident, got involved over a drink on the boardwalk when I came back from breast cancer treatment, and sort of my role by White Yellow Cross was ending. And I told them, I was like, I'm going to retire and I'm going to enjoy life. And I met one of the board members and I said, God, maybe I see you got startup subsidy. Maybe I'm available to help. Because the years working by White Yellow Cross, we had a lot of psychiatric patients coming in that we could not adequately treat because you just did not have a psychiatrist, trained staff. The accommodations were not really for that. They were for elderly and nursing home persons. So the next day they called me.
Really?
And we discussed, and I designed a startup project for that year. And by the end of 2006, we had it all together. We had a little clinic on Avbz Scott Road. I don't know if you remember.
Yeah.
And we had a doctor. We found a doctor to be flown in monthly. And some nurses and administrative staff. We had set up an administration, etc. And applied for actual subsidy for the following year. So formally, in January 2007, we really started to function. It was a roller coaster ride. I can't say that I did it. I think it was a team effort. And we really worked hard. The nurses...
But you were the face of the whole organization.
Well, I make a lot of noise to get what is necessary for the patients. The nurses are more humble and they just want to care for their patients. And they don't really want so much confusion. But they really did a huge job. Yeah. We even set up an information and prevention department that was also subsidized at that time. Then in end of 2014, I retired. Things were getting, I think, on the one hand, politically, I was not really accepted. Maybe the way I approached matters, the way I looked at things was not politically the way it should have been. But on the other hand, you're caring for very sick people. And it was hard to make people understand what is necessary, what the staff needs, what kind of facility you need, and everything. We did manage to buy a building in 2010, renovate it. We moved in 2011. So from then on, we were not flying out patients anymore. So I do think I can say I'm proud of St. Maarten, proud of the people. The majority of the staff is local. We did to get a qualified social psychiatric nurse. Mostly they come from Holland. few of them survive. You need people that are flexible. I think in a Dutch system or maybe in an American system, things are regulated. And there are resources you can tap into. We don't have that. The resources are you.
Right.
And our local people are the resources, and they manage it. And they don't mind doing things. So yes, we did it together. Even with government, with Avbz, I have to compliment Avbz on always supporting us. Even when finances got difficult, they always fell through for us. The police, we always had their support. I hear lately it's becoming a struggle, but the problem is that you need continuity. You need a person to run an organization like that that does have a long-term vision and that anticipates on. Like we used to produce, at least in my time, a social year report that established, they're still on the website, how many patients have we seen? What were the diagnoses? What expansions do we need? What changes do we need? So I'm hoping that everything would continue. It's hard to find qualified people that can manage the way I just expressed. So after Irma, I was called back. And some incidents had happened during Irma whereby the nurses couldn't find patients to medicate them. And I figured, yes, we need the building now that we had bought in 2010 was way too small, it's falling apart. So I immediately applied for funding. And I submitted it in 2018. So it's a longer trajectory than the airport is taking. Wow. To get it off the ground, which is sad. And also for me, the way I was being approached by NRPB, I don't think I deserved. So a year ago, I told the board, I'm 70, going on to 75, I was 74 then. I don't think that I deserve this kind of attitude from young lawyers working there that never did a project before in their life but know everything better. Even were threatening me that if I did, why did I write a letter to the minister? Like, if I am told by government and by NRPB that the funding that we received from after 5 years of a process was not going to be allocated to mental health anymore, what do you want me to do? I immediately informed the minister.
Exactly.
Come on, if government wants money from the World Bank, apply yourself. But don't come and tell me that you want to use it for something else. So I really, really was frustrated, to say the least. And the minister did take action, and right now they're moving on with the project as it was allocated by the World Bank. But very slowly. It's going very, very slowly. I mean, we bought land before I stopped in St. John's because the building we mental health still has in Cahill was mortgaged by the Windward Island Bank, and we had paid it off. So I went to the bank and I said, listen, I know if I need to get this money from the World Bank, I must have the land. They will not finance land. And they agreed to extend the mortgage to purchase the lots in St. John's that are on the L.B. Scott Road, which is really a beautiful location. It's close to Whitechapel Cross, close to the hospital, accessible, and it was commercial land, so we would not have problems, with can you do it there or can't you? And for a whole year, what is NRPB telling me? They have to determine whether or not there are archaeological artifacts there. Yes. I'm like, guys, it's developed land by an estate. If there were artifacts, they're gone. Then there was a whole year issue about a temporary fence. I said, you could put up a temporary fence, but guarantee me with a hurricane that you're going to take it down. I was holding back the project. None of this, and that brings me to, had anything to do with what the patients of the Mental Health Foundation needed, what the objective of the project was. It's all personal power play. Why? Please tell me why. How did you get mental health to where it is today? Not because I was on a personal roller coaster ride for anything. I was there because since I came to the island in 1995, I knew of the need of the population. And I focused on that and that alone. Now, if I then will get frustrated and angry because you're telling me crap, sorry for my language, you're going to have to accept it because that's who I am. I'm defending what I feel and what I know by law the people are entitled to. That brings me to the Avbz law. Every person working and living on St. Maarten legally pays into a fund. There is more than 1 million guilders in that fund. How is it possible? The fund is not being allocated for what it's intended. And if you read the law, it states clearly, every person paying into that fund has a right to the fund. Now, the manner in which it was set up in the Curaçao days was really for Curaçao and was not the way, it was not dispersing the funds in the right way.
That's before 10-10-10. Yeah.
It was before, we literally took it over the way it is and left it that way. Meaning, if tomorrow I am chronically ill and I need to tap into that fund, I can't do it personally. It has to either go through White Yellow Cross or Mental Health Foundation. No, the law has to change. I should be able to apply for what I paid for.
Without going through that whole...
Of course. Asking nurses to check when the patient is in care for 90 days. I tried with data programs and signs coming up in the program. Nurses, now you have to go to Avbz for this person. That's not their job. Allocating a person to the Avbz should be signaled by the insurance companies. I had at one time a big issue, for instance, with Nagico. If you're insured by Nagico for mental health, they only pay up to 3,000 guilders a year. Now, if a person is admitted for 10 days, that person, 3,000 guilders is gone. Yeah. So I had a discussion with them and I told them, if you take them out of the insurance, I could never apply for Avbz for them. Because to enter into Avbz, and a lot of people don't know that, you need a medical insurance. Because Avbz only covers care. It doesn't cover your specialist, your medication, etc. That your medical insurance has to do. So I was lucky that Nagico did agree to then continue the care longer. No, Nagico, if you have a patient in the hospital for almost a year because the person cannot be transferred home or to White Yellow Cross, you should signal that that person has paid for Avbz and should be entered into Avbz care. Are the facilities there? That's another problem. That's why we have more than 1 million guilders in the fund, because we never created the facilities that the people of St. Maarten are entitled to. Now we're going to a basic health insurance. Or what, it changed name again, it was NHI. I don't know what it is now. I really don't even think I want to know.
He's carrying the name now of a minister.
But what I do know is that they're trying to put the Avbz fund, because after Irma and after COVID, asset fee is in problems. What is going to happen with our primary health care, our affordable care, our preventative care? that is supposed to come out of the Avbz fund. If you're going to merge it together, what are our rights? Are we as a population informed of what you're going to do with our rights, with what we paid for and what we're entitled to? I don't know. And I think that is where my message to our politicians would be, please inform the population a little bit more. Enhance your information system to continuously informing them. As ZV, I see, is trying in a way to inform the population of their services. But care. What are your rights? We pay for it. We do not get it free.
And that's why when I introduced you at the beginning of the program, and what I said about you, because you are a remarkable lady. In Simran, you don't get people to stand up, to challenge the system the way you did for a right cause. And that's why I say you became the face of the Mental Health Foundation. You were there, you understood it, and you had this passion. And I think too often on this island, we don't like that.
There are two things I discovered that would happen in trying to develop mental health. And I did get opportunities. And how did I get it? Was by saying, don't look at me. It's not for me. It's for the patients. Right. And then they would budge. But mostly it was, okay, if you go to the Ministry of Health with a project, with an idea, we have to do research. Then the research is done, you ask them, okay, what are the results? It's government confidential information. What the? Please, how is that? Where is our transparency? Is the result not really what you thought it would be? Let's sit together and do something about it. But don't give me it's confidential information. Now I hear again they're going to do research. You ask them, we don't have data on mental health. I said, did you read our social year reports? Data is there.
Mental health is one of the few areas where they have data, actually.
We had data all the time. I send it to the lady. I see her after a while. Did you read it? No. I'm like, come on, guys. If you want to move on, we have to be willing to work together. Right. Don't see what your institute mental health is doing as a threat to your function. It never will be, and it never is. It needs you. We need government with a vision how to move forward, not to work against us.
So then you was a director of the Mental Health Foundation for approximately how many years then?
It goes on 15 years, I think. Yeah.
Well, you were the first person there.
Yeah.
And your staff grew over the years to a lot of people.
Yes.
From just a few to...
Today they have about 50 staff members.
That's a lot.
They're short of psychiatrists.
That was always
which is sad. It is a challenge. Yeah. And that is another example. I had 2 psychiatrists from India for 9 years. Never a problem. Medically, they were very good. There was never a medical problem. Anyhow. Then there comes, what happened? I think Dr. Gandotra went and he became Dutch. They were the this is what I wanted to say. They were the old school educated doctors. So they were real doctors. And for me, it was also difficult working with them and trying to get them into a culture of team play. It's a team effort, etc. He especially wanted an own practice and he wanted to do his own thing.
Outside of the...
Yeah. And I tried to convince him that it would not be feasible if you have to set up an office, have an assistant, have a computer program. It's going to cost you more than the revenues that would come in. But he, stubborn man, they don't listen to women. Actually, he learned to speak Dutch very fast. Why? Because he was doing the psychiatric reporting for the public prosecutor. And that comes in Dutch. So he, in the beginning with a nurse, I'm like, Doc, you can't do this. Then he was Googling. Then I see he understands every word that's in the documents. So he became a Dutch citizen fairly fast. And he applied for a permit. And then it gets denied. He takes them to court and he wins the case. Now, that is now the reason to say you cannot employ Indian doctors anymore. Like we can get psychiatrists just like that from everywhere. You know what I mean? And now they have to be BIG registered from the Netherlands or equivalent. Then I had 2 BIG registered and it was one big problem the whole time. Can we please start our own vetting system?
Oh, you sound like an attorney I had there last week. They said the same. Roland Duncan said the same thing.
Guys, let's be proud of what we can do.
Yeah.
No. Now, all doctors coming here are vetted in the Netherlands again. Yeah. We're going backwards. Do we want to become independent? We talk about that. No, you can only talk about independence if you are willing and able to discuss a healthcare vision, a social vision, with all the institutes involved and work with them and not against them.
I tell you what, Ms. Healy, I have to go to a break. When we come back, we're going to continue speaking with Ms. Eileen Healy. She is the former director of the Mental Health Foundation, an advocate for mental health on St. Maarten. Did a remarkable job. Always willing to come on this show to speak with us about mental health, and we appreciate it. Although she's now retired, she's back, and we really appreciate that. So when we come back, we'll continue right here on the Oral Supply. Please stay with us.
We are vibrant, expressive, warm, and diverse. Together, we conquer, and now we expand into new horizons, giving you more of the best. Introducing our new Avbz Plus with wider acceptance, purchase protection, and enhanced security. Whether you're online, traveling, or in paradise, experience more with Windward Island Bank. Avbz Plus. More of the best.
My guest you've seen there is Ms. Eileen Healy, former director of the Mental Health Foundation, and now retired, but have a real passion for what she's doing. So, you point out a lot of things, and I had attorney Roland Duncan here recently. We celebrated 50 years as an attorney last year, 2024. It said the same thing you said about the medical professionals in terms of bringing doctors, etc. It's time that we get past that, or else we're going to end up in serious problems down the road. So
we have to get past a lot of things.
Exactly.
I want to go back to the Avbz idea. Avbz should also be funding primary health care. I was telling you before the show, briefly, that when I just came here, it was Hurricane Louis. The year after was Nurses Week. And I sat with the staff and I said, let's do something else. It was the staff of White Cross and then just a walkathon and a party. And they decided on a panel discussion on social care. There was a politician there, there was SVB there, and a medical center rep. It was a beautiful discussion on how are we going to care for each other. It was really a nice evening. It ended that the 3 panelists were outside, and medical center is in financial trouble, and they're going to finance the aftercare, the doctor's nachtdienst, because the doctors close at 5 o'clock, to medical center because they're in financial trouble. Just coming from Holland, I knew you try to encourage people to first go to their primary health care and then to the secondary health care, which is terribly expensive. Now, by doing this, you're encouraging people to go to the hospital for every little thing. It's still there, I think. That's the way it's still going. We needed to help medical center. Working by Whitechapel Cross, I found a report written in 1982 that established that if there was a report regarding the building of the existing hospital, and that report established that if we do not enhance our primary health care, the hospital will be in financial trouble. Well, what happened? Today, we're building a high-end hospital. What's happening with our primary health care? We're still encouraging people to go to the hospital and to fly abroad.
But why?
We still get, even mental health gets patients that wants to fly out their patients, while we can provide everything. It's how our government, our officials are educating our people. That everything outside and up there is better. No. First of all, start educating the people to take care of themselves, to do sports, to eat healthy, do something about the price of food. It's killing us. Are we doing that? In 2000, we had a huge How Healthy is St. Maarten research done. What came out of it? Obesity, high blood pressure, dialysis, all those problems related to obesity and high blood pressure. It's still exploding till today. What did we do with those results? It's probably not popular to do primary health care, I don't know, or to really enhance it. But if we want to move forward, mental health started with primary health care because we could not admit patients. We were stabilizing patients at home. If it was possible to do that and to get the family involved, we discovered the huge advantage was that before the patient would relapse, the family would already contact us. Instead of flying them to Curacao, come back in 2 weeks, family doesn't know what to do, and the patient is flown out again. That was happening. Aren't you proud of your foundation? Do you want to support the primary health care that they are doing? I never experienced that. I'm sorry. I'm proud of what we established on St. Maarten, together with the people that did support us, together with the staff, the board of the foundation. Yes, we came a long way. I think in other countries, it would not have been possible. Also, a lot of countries, people don't know that, but should know it, and our politicians especially, is that a lot of people are looking of other islands to what we have in the sense of mental health care. It's rare that you have one foundation that does primary health care, can admit, do crisis intervention, has a day treatment facility, has occupational therapy, all under one roof. Yeah. The patient doesn't have to go from the psychiatrist to another institute to get the necessary care.
See, a lot of people are not aware of
Everything
that.
is under one roof. They're working very hard, the staff, till today, to keep it like that, to maintain what they're doing, and they're proud of what they're doing, and I am proud of them too.
I'm proud of you all. I don't know if you remember, you took me on a tour of the building. I was impressed with what you had there at the time. That was many years ago. That's more than 8 years ago. So, we've come a long way, and it's just amazing because primary care on St. Maarten is really neglected.
Yeah.
You go to the hospital, we have to wait
for hours,
a lifetime just to get through. And I don't know when that's going to change.
You know, the crazy thing, when I started mental health, I went to Curacao because we had a relationship with Capriles Clinic. And they had a beautiful director there at that time, Dr. Oosburg.
For people who don't know Capriles Clinic, that's the mental
psychiatric facility in Curacao. And Dr. Oosburg looks at me and, Eileen, you're crazy. I said, I know, that's why I'm going to do it. But I need your protocols. I need procedures, I need job descriptions, I need all these things. He gave me literally everything. He said, Eileen, we're there to help you. We still, till today, Mental Health Foundation has an agreement with them. In emergency cases, we could still send people there. They really helped. I have to also compliment, they were open for anything. They're doctors. So, yeah, we did set up a professional organization with protocols, with procedures, how to go about matters, training staff. We did it together with Capriles a lot of times in nonviolent approaches, how to stabilize violent situations. We involved the police officers with it over the years. I hope it continues because the nurses need the support of the officers going into the community. They can't do it on their own.
And they need training to the officers.
Yes, right. yes. Prison too.
Right.
We also, mental health also goes to the prison, tends to the prisoners that need mental care.
But did that improve there? Because many years ago, I was taking a tour of the prison, and they showed me they had only one cell to handle a mentally ill prisoner. I don't know if it's
still one. Yeah.
Still one? Wow.
It's still one. So that's why preventing crisis situations is so important also in the prison. Before a person becomes psychotic, you can observe symptoms that are going to cause him to, get on. And it works. It is really helpful also for the staff.
Yeah.
So, we had wonderful relationships with we even cared for psychiatric patients from Sabine Station. They are admitted to us. We work with Turning Point, persons that came in a crisis but were predominantly addicted would be transferred.
Still work with Turning Point?
The Turning Point, yes. I hope. Safe Haven was also one of our clients that we work with. We also work with the staff. So many.
Yeah, no, it's just a great job that Mental Health Foundation is doing in St. Maarten. I always tell people, if there are two organizations I admire for the work they're doing, it's Mental Health Foundation and also the White and Yellow Cross Foundation.
Correct.
They're doing a great job.
Mm-hmm.
Yeah. And sometimes the average person don't realize that, because when you compare us to the neighboring islands and those two organizations I just mentioned, there's nothing like that.
No,
well managed, organized well.
Yeah.
And I remember many years ago when you mentioned the number of patients, a lot of people didn't believe it. Now you're hearing people and politicians mentioning it's a high number of mentally ill persons.
But the majority of them have a job.
They still function, yes.
They still can function, and that's where it's important to continuously inform the public of reducing the stigma. Yeah. Let people know that, you can function.
But it's getting better. That stigma is going.
If you get care. Yeah, we came a long way. Yeah. That is true. We did have issues with the side effects of medication in the past. People that are long-term on medication, it always has side effects. But what I understand lately is that the medication is improving. The side effects are less. But it is important that those patients are continuously monitored. Yeah. Blood test is taken. It's very important to keep track of the developments. Yeah.
No, I have a few minutes remember. I've got to ask you this. What do you think that people don't know about mental health in St. Maarten that they should know about?
I think I mentioned everything, that they work very hard. Please be patient with us. That the foundation is not perfect yet, but hopefully we're working towards a perfect foundation with the support of our government, our insurance companies, medical insurance companies. We have come a long way, but there's still a lot of work to be done. We used to also visit schools. That has stopped. We just didn't have enough resources to do that. We should be able to be given the opportunity to be back out there again and, you know, reduce the stigma. We used to make these little films that were up on those days on TV. Now it's on YouTube and wherever, I think. We have to continuously be doing that. It's too often that you start something and you have to end it because the financing is not there. I think we need to plan better together with government. This is our plan, mental health plan. Where will you support this plan? Where can you chip in? Where does the medical insurance chip in? The medical insurance spend a lot of money on commercials. Come help us a bit. Yeah. Do something. I used to do it myself, go and look for sponsors to make these films. But as a director, it's a lot of work. You have to go begging and explaining over and over. Yeah. I couldn't do it on my own all the time. You need adequate information and prevention platform that brings this out. Like Aid Foundation is doing it on its own. This foundation is doing, let's form a platform and be out there and have continuity of the information to the public. It's a matter of educating, and they will understand more.
Definitely. Well, I want to thank you for coming in. I hope we can still call on you, although you're retired now, because it's always a pleasure having you and listening to what you have to say. I think it's so important for the community also.
Thank you very much for having me. I hope nobody was offended by the things I said. I hope they see it as positive criticism. When you're studying for a master's degree, you're criticized all the time. So I was used to being criticized. So people out there, it's for the people of St. Maarten, not for me. Let's move on together.
Right. Well, Miss Eileen Healy, again, thank you. You're a remarkable lady. Did a great job. And we'll have you back sometime soon again. All right?
Okay, thank you.
And that's it for now. And speaking of other things, see you next time on Facebook, YouTube, and on Hot 99.9 FM radio. Take care. Bye.